High blood pressure is often referred to as the silent killer, and for good reason. It doesn't cause pain. It rarely presents obvious symptoms. And for many older adults, it develops gradually and unnoticed until a serious event, such as a stroke or heart attack, suddenly brings it to attention. What makes it even more dangerous is how easily the everyday habits that contribute to high blood pressure are overlooked. Everyday choices, what you eat, how much you move, how you handle stress, play a much bigger role in your blood pressure than most people realize. Many individuals over 50 believe they're doing all the right things. They take prescribed medications, attend medical appointments, and try to stay active. But often hidden within their daily routines are subtle, unnoticed habits that may be slowly elevating blood pressure or interfering with treatment. Without awareness, these habits persist, silently placing strain on the heart, brain, and circulatory system. That's the importance of this guide. This isn't about confusing you with medical terminology or making you feel guilty. It's about offering clarity, shining a light on common mistakes older adults make regarding blood pressure, and providing straightforward, realistic changes that can make a meaningful impact, whether you've been managing hypertension for years or have only recently started monitoring your blood pressure. This resource is designed to help you feel empowered, supported, and informed. Because managing blood pressure isn't just about numbers, it's about staying mobile, thinking clearly, sleeping soundly, and living life with assurance. And it begins with understanding what to avoid, and what to change. Let's begin with the first commonly overlooked mistake and work toward building a healthier, more stable foundation for your cardiovascular health, one smart habit at a time. Mistake number 1: skipping your medication. For many people, managing high blood pressure starts with a prescription. These medications are highly effective, when taken properly. Yet a common and dangerous mistake among older adults is skipping doses, taking them at irregular times, or stopping altogether without consulting a doctor. This might happen for several reasons. Some simply forget. Others feel fine and assume the medication is no longer necessary. Concerns about side effects, a dislike of relying on medication, or efforts to stretch prescriptions due to cost can also play a role. While these decisions may seem harmless, they can result in unstable blood pressure levels. Putting increased strain on the heart and other organs, blood pressure medications are precisely calibrated to your body's needs. They don't just lower a number, they help protect your arteries, heart, brain, and kidneys. Missing or incorrectly taking doses can lead to silent damage over time. Even if you feel perfectly normal, it's also important to understand that these medications don't usually produce a noticeable, feel-good effect, which makes it easier to undervalue their impact. But make no mistake, behind the scenes, they're doing vital work, improving blood flow, relieving cardiac strain, and preventing serious complications. The solution is consistency. Make your medication part of a daily routine. Take it at the same time each day, using tools like pill organizers, alarms, or checklists to stay on track. If you miss a dose, don't double up, contact your doctor for guidance. Experiencing side effects. Talk to your provider about alternatives. Never stop taking blood pressure medication just because your readings are normal. That's often a sign the medication is doing its job. Also, if cost is an issue, speak with your healthcare provider. There are often affordable alternatives, generics, or assistance programs that can help. Mistake number 2: consuming hidden sodium. You might not be adding salt to every meal, but sodium could still be sneaking into your diet in surprising ways. One of the most underestimated contributors to high blood pressure is the sodium hidden in everyday foods. High sodium intake directly correlates with elevated blood pressure. Salt causes the body to retain water, increasing blood volume and exerting extra pressure on artery walls. Over time, this burden can damage the heart, kidneys, and arteries, often without obvious symptoms. Packaged and processed foods, canned soups, frozen meals, deli meats, sauces, breads, even seemingly healthy items like low-fat dressings, are often loaded with sodium. It's added for taste and preservation. Even products labeled light or heart-healthy can be deceptively high in salt. This concern becomes even more pressing as we age. The kidney's ability to process sodium declines, making older adults more sensitive to its effects. Sodium also contributes to water retention, worsening issues like swelling and heart failure. The first step to reducing sodium is awareness. Begin checking labels for sodium content. You may be surprised how quickly it adds up. A single serving of soup might contain over half the daily recommended amount. Even bread and cereal can be significant sources when eaten regularly. Look for low sodium labels, 140 mg or less per serving. Or no salt added options when possible. Practical habits also help. Rinse canned beans and vegetables, choose fresh or frozen foods without added sauces, and cook at home when you can. Flavor meals with herbs, spices, vinegar, lemon juice, garlic, or pepper instead of salt. Your taste buds may take a few weeks to adjust, but they will. And you may come to prefer the taste of fresh, naturally seasoned foods over salty processed ones. Reducing sodium doesn't mean sacrificing enjoyment. Mistake number 3: not monitoring blood pressure regularly. Blood pressure is tricky, it can be dangerously high, yet you may feel perfectly fine. That's why it's often called a silent threat. A significant mistake many older adults make is not checking their blood pressure regularly, or relying only on annual doctor visits. Blood pressure fluctuates throughout the day due to stress, activity, sleep, or meals. One good reading at the doctor's office doesn't show the full picture, and sometimes those readings can be inaccurate due to nerves or other factors. That's where home monitoring becomes so valuable. It provides ongoing insights into your actual blood pressure patterns, which can help identify issues early, before they turn into emergencies. Regular monitoring can reveal whether medication is effective, if lifestyle changes are working, or if new habits, even supplements, are interfering with treatment. Monitoring at home is simple and empowering. Use a reliable home monitor, preferably one with a large screen and memory function. Measure your pressure at the same time each day, like in the morning or evening. Rest quietly for 5 minutes beforehand. Sit upright, with both feet flat on the floor, and avoid talking during the measurement. Keep a log, whether on paper or through an app, and share it with your doctor. This record makes appointments more productive and allows for better treatment decisions. Some people avoid checking their blood pressure out of fear. But ignoring the numbers doesn't prevent problems, it just delays the response. Awareness is the first step to control. With regular checks, you're not just observing, you're taking charge of your health. Make it part of your daily routine. Stay informed. Stay engaged. Your health depends on it. Mistake number 4: ignoring chronic stress. Stress isn't just a mental state, it takes a toll on your body. Among its many impacts, chronic, unmanaged stress is a major but often overlooked contributor to high blood pressure. When you're stressed, your body activates the fight or flight response. This releases hormones like adrenaline and cortisol, which temporarily raise blood pressure by constricting blood vessels and increasing heart rate. While this reaction is normal in short bursts, prolonged stress can keep your body in that heightened state, leading to long-term damage. What makes stress particularly sneaky is that it doesn't always show up in dramatic ways. It can manifest as muscle tension, difficulty sleeping, irritability, or simply feeling overwhelmed. Many seniors have been conditioned to tough it out or stay strong, making it easy to downplay or ignore the effects of stress altogether. But pushing through without addressing stress only allows it to accumulate, quietly increasing strain on your heart and affecting overall health. The good news: managing stress doesn't require big changes. Small, consistent actions can make a big difference. Deep breathing exercises, gentle movement like stretching or walking, time in nature, listening to calming music, journaling, prayer, or simply talking with someone, all help reset your body's stress response. The key is building regular stress relief into your routine. Don't wait for things to get bad. Make space every day to slow down and unwind, just like brushing your teeth prevents problems before they start. And if you've been dealing with stress for a long time, be patient with yourself. This isn't about blame, it's about recognizing opportunities for change. Take one small step, then another. Over time, your body will respond with better sleep, steadier blood pressure, improved digestion, and a stronger sense of peace. Mistake number 5: overlooking physical inactivity. When it comes to managing high blood pressure, what you don't do can be just as critical as what you do. One of the most common yet underestimated errors, especially among older adults, is neglecting physical activity. Too much sitting, too little movement, and the assumption that rest is always the best remedy can quietly elevate blood pressure and put added strain on the heart. While rest does serve an important purpose, a lack of regular movement can gradually cause your heart to work harder than necessary. Exercise plays a vital role in blood pressure control because it strengthens the heart muscle. A more efficient heart can pump more blood with less effort, which in turn decreases pressure on your arteries and helps maintain a healthier blood pressure range. Beyond that, physical activity enhances circulation, helps manage weight, reduces inflammation, and eases stress, all essential to cardiovascular wellness. When daily movement is minimized, the body begins to lose its efficiency. Muscles weaken, blood flow slows, and pressure in your blood vessels can creep upward. For many seniors, it's not motivation that's lacking, it's uncertainty. Concerns about joint pain, fatigue, or fear of injury may make the idea of exercising feel daunting. But physical activity doesn't need to be intense to be beneficial. Light, consistent movement can bring meaningful results. A short walk, gentle stretches in the morning, or seated exercises while watching TV can all stimulate blood flow and support heart health. One of the most impactful changes you can make is simply to reduce prolonged sitting. If you often find yourself watching TV or reading for extended periods, try to stand up every 30 to 60 minutes. March in place, stroll to another room, or do a few gentle stretches. These small bursts of activity help counteract the stiffening of arteries and the rise in blood pressure that come from being sedentary. Mistake number 6: excessive caffeine or alcohol use. A cup of coffee in the morning or a glass of wine in the evening is part of many people's daily rituals. In moderation, they can be comforting and enjoyable. However, for older adults trying to manage high blood pressure, consuming too much caffeine or alcohol is a frequently overlooked mistake. These substances may not seem harmful in small amounts, but they can subtly raise blood pressure, reduce the effectiveness of medication, and contribute to other health complications. Let's look at caffeine first. Found in coffee, tea, soda, energy drinks, and even chocolate, caffeine acts as a stimulant. It narrows blood vessels and increases heart rate, both of which can temporarily spike blood pressure. For some, this effect is mild and brief. But for others, particularly those with high blood pressure or heightened sensitivity, even small amounts can cause significant increases. What makes caffeine tricky is its variable effect. While one person may tolerate a daily cup of coffee well, another might experience hours-long blood pressure spikes without realizing the cause. Awareness is key. If you regularly consume caffeine, consider monitoring how your body responds. Try checking your blood pressure before and after your usual coffee or soda. If you notice elevated readings or symptoms like headaches, restlessness, or a racing heart, it might be time to reduce your intake or opt for decaf. You don't need to abandon your comforting habits entirely, just make smart adjustments that support your heart health. Alcohol poses different challenges. While a small drink may help some people unwind, excessive or frequent consumption raises blood pressure and can seriously interfere with blood pressure medications. It also contributes to dehydration, weight gain, poor sleep, and increased emotional stress, all of which can worsen hypertension. Mistake number 7: poor communication with healthcare providers. Successfully managing high blood pressure involves more than just taking the right medication or eating the right foods. It also requires a solid support system, with your healthcare provider at its center. One of the most common and preventable missteps older adults make is not staying in regular, open communication with their doctors. This can take many forms: missing appointments, downplaying symptoms, or assuming everything is fine without really checking. But without open and ongoing dialogue, key warning signs may go unnoticed, and valuable treatment opportunities may be missed. It's easy to fall into a routine, refill prescriptions, attend annual checkups, and hope everything is on track. But blood pressure is not a set-it-and-forget-it condition. It can fluctuate based on stress, diet, sleep, physical activity, seasonal changes, and interactions with other medications. If your provider doesn't know what's happening day to day, they're working with an incomplete picture, and that can hinder your care. Many seniors hesitate to speak up due to fear of being a burden or not wanting to seem bothersome. But when it comes to your health, no concern is too small. Whether it's a new symptom, a side effect from medication, a supplement you've added, or a change in your routine, sharing this information helps your provider tailor your care more effectively. Medication side effects, in particular, are often underreported. Some individuals simply stop taking a prescription because they dislike how it makes them feel, but never mention it to their doctor. This can result in uncontrolled blood pressure or more serious complications. A simple conversation could lead to an adjusted dose or a different prescription with fewer side effects.